what most people don't understand is that the aftercare after liposuction is just as important as the surgery itself. Neglecting this period can lead to serious consequences, which is why in this video I'm going to tell you everything you need to expect after a liposuction. Hello and welcome to my channel. My name is Glory Udom and I'm a medical doctor currently based in Abuja, Nigeria. In this video, I'm going to tell you what happens after a liposuction. Liposuction is becoming an increasing... I have another video. It should be somewhere here. I'll link it in this video or in the description box, where I tell you everything you need to know about liposuction and I give you some tips. I give a brief overview. So if you haven't watched that, please watch that video. I'm going to divide the aftercare period into three parts: the immediate post-op period, the much less acute phase, and then after that. So the immediate post-op period is from like immediately you come out of surgery to day 5 to day 7. Then from the much less acute phase is from like day 5 to day 7 to week 3, week 4, and then above week 4. Please note that this classification differs for different people. It's not anything cast in stone. I'm just making this classification for the purpose of this video to be able to accurately, just summarize what to expect in each of these phases. Now, in the immediate acute phase, immediately you come out of surgery to day 5 to day 7, the things you should expect, the first thing that happens after liposuction you should expect is that they're going to be drains. We make use of tumescent fluid. Again, if you don't understand that, I explained that in my previous video, what is liposuction and things you should know about liposuction. We make use of tumescent fluid to bring out fat. So for days after the surgery, you will be draining that fluid. And remember, that fluid can contain, that fluid sometimes could be blood stained, and sometimes it really like gets the patient worried and like, am I bleeding? It's not bleeding, it is you're draining fluid. It's not blood, it's just blood stained fluid. You're draining fluid, which is part of the fluid that we put in to remove the fat. So sometimes it comes out stained in blood. It's hydration. That's another thing that you can expect. It is possible to happen during this period. Now, I said you could be draining fluid. You will be draining fluid because we make use of fluid to bring out the fat. So it is possible for the fluid content in your body to reduce and you could become dehydrated. This is part of the reasons why I'm also reiterating that this aftercare period is just as important as the surgery itself, because you need to monitor your fluid level. Your fluid input output level needs to be monitored to be so that you don't go into, the patient doesn't go into dehydration. Another thing that could happen in this period that you should be expecting that after a liposuction in this period is swelling and bruising. Many times after we take out fat, especially people that are light skinned, fair in complexion, you could see some bruising underneath the skin in this period. It's nothing to worry about. It will all go away, and also the swelling. Another thing is medications. After liposuction, especially in this period, you're going to be on a couple of medications. You're most likely going to be on antibiotics, you'll be on painkillers, and even some hematinics. So it is important to know that you're going to take drugs after this period. Some can even be IV. We start with IV immediately post-op, and then we taper down and then convert everything to oral as the days goes by. But in this particular period, you should expect IV and IV medications. And then also very importantly is your blood level. Like I said, when you're draining in this period, like you're bringing out the fluid that for the first few days after the surgery that we used to bring out the fat. Sometimes it comes out looking a little bit blood stained. Some people don't lose a lot of blood during liposuction, but other people do. So your blood level needs to be checked so that you don't become anemic and start having other symptoms like easy fatigability and then weakness and fainting spells. Those are the things that you should expect in the first 5 to 7 days after the procedure. So you can see that your aftercare is very important. You need to be around trained medical personnel that can help you to identify these things or keep an eye on these things so that they don't, lead to much more serious consequences. For the second stage, which is from day 5 to day 7 to week 3, week 4, major things that you should expect after a liposuction in this phase. The first one is usually massages. It is around this period that people start massages, from after day 5 to day 7. Like I said, it differs for a lot of people. It is after this stage that people start massages. I'm going to have a video up here very soon. I'm going to put the link here. about what massages after liposuction is all about. So this is not your regular massage, relaxation massage. No, this is a therapeutic massage after liposuction, and this is very important. And it is during this period that you get it. Apart from the massages, there will also be some swellings and then hardening. Yes, during this period, you tend to experience some hardening, like the part of your body that fat was taken out from now starts to seem a bit hard. It is completely normal. It is part of the healing process, and as time goes, it will get softer again. As what I'm going to talk about is greater than 4 weeks. Please note that from day 5 to day 7, the second phase, day 5 to day 7 to like 3 weeks to 4 weeks, you're a lot stronger now. Most people start to be able to walk around, can start to do what they're doing, get back to their daily activities. Now the last phase, from week 4, you're practically almost back to your normal self. Like you can just do basically what it is that you've been doing. In fact, from this point, we rarely see many of our clients for follow-up. We lose a couple of them to follow up from this point because they're strong enough, especially people who traveled in from other countries or other places to have the surgery. They usually go back by this time, so they're back to their normal activities. Things to expect in this phase: itching. A lot of clients complain about itching. They can feel itching around their body. It's a common should I say side effect of the procedure, and it happens. You can take some antihistamines and it can help reduce those symptoms. Some people also experience fevers. Yes, some people experience, it's more like a metabolic response of the body to the procedure. And so some people in the evenings, they start to experience these fevers, which after taking a dose of paracetamol, they're okay and it's just fine and everything is okay. So that's a basic summary of everything that happens after a liposuction. If there's anything that I didn't cover or you have any question, please hit me up in the comment section. I love to read from you guys. I'd love to hear from you, and then we can talk more about this. If you enjoyed this, please don't forget to share this with your friends, comment, subscribe, and yeah, thank you very much for coming to this part of the video. My name is Udom. Thank you.